Hello everyone, welcome to Dr. Coda's medical coding classes. So today we are discussing chapter 14 of ICD-10, that is disease of genitourinary system. So the code range for this chapter is N00 to N99. So this chapter is a very simple chapter wherein we have only 4 to 5 guidelines, and all the guidelines revolve around one single condition, that is chronic kidney disease or CKD. So the code for chronic kidney disease or CKD is N18 series. So first one is stages of chronic kidney disease or CKD. So the stages are stage 1, stage 2, stage 3, stage 4 and stage 5. And the corresponding codes are N18.1 for stage 1, N18.2 for stage 2, N18.3 for stage 3, N18.4 for stage 4 and N18.5 stage 5. In some case in the documentation, it will be given as mild CKD, moderate CKD or severe CKD. In that case, if it is mild CKD, we have to take if it is mild CKD, we have to take code N18.2. If it is moderate CKD, we have to take code N18.3, and if it is severe CKD, we have to take code N18.4. Next one is N18.6, that is end stage renal disease or ESRD. So if in the documentation it is ESRD or end stage renal disease, the code is N18.6. Next guideline is, if in the documentation it is given as both ESRD and stage of CKD, then we have to code only N18.6. Okay. And the next guideline is, if in the documentation it states like the patient is having some stage of CKD which requires dialysis, then we have to code additionally a Z99.0, that is dialysis status. So in addition to stage of CKD or N18 series codes, additionally we have to code Z99.0, that is to identify the dialysis status code. Next one is CKD or chronic kidney disease and kidney transplant status. So even after the kidney transplant patients even after transplant, they may have still some mild stages or stage 1 or 2 of CKD. In that case, first we have to code the stage of CKD, that is N18 code, and after that we have to code Z94.0, that is just to show the status of kidney transplant. So for example, if the patient is a kidney transplant patient and is having stage 1 CKD currently, then the first code will be N18.1 and the second code will be Z94.0. And if it is stage 2 CKD and a kidney transplant patient, then the first code will be N18.2, then the second code will be Z94.0. So for all cases, we have to show the kidney transplant status code, that is Z94.0. Next guideline is CKD with other conditions. First one is CKD with hypertension. If the patient documentation states that the patient is having chronic kidney disease and hypertension, then we have to use a combination code I12. So in that case, the first code will be I12 and the second code will be stage of CKD, that is N18 series. Okay, so if the patient is having CKD stage 1 with hypertension, then the first code will be I12 and second code will be N18.1. Then the next guideline is CKD with diabetes mellitus. So if the patient documentation it states like the patient is having chronic kidney disease with diabetes mellitus, then our first code will be E08.22 or E09.22 or E10.22 or E11.22. This depends upon the type of diabetes. For example, if the patient is having type 1 diabetes with CKD, then the code will be E10.22. If it is type 2 diabetes with CKD, then the code will be E11.22. If it is diabetes due to underlying condition, then the code will be E08.22. If it is due to drug, if the diabetes mellitus is the adverse effect of a drug, then the code will be E09.22. So the first code depends on what type of diabetes it is. And the second code is stage of CKD. Okay. That's all for chapter 14. This is a very simple chapter. If you have any doubts, you can ask in the comment section. Thank you.